They had apartments, they had assisted living, they had a rehab floor, and then they had the memory care. And I just got really lucky in my first job after school that I just found my place. I loved it. So I've been working in aging since then, basically since I was 21 or 22. I have worked, I've done that. I've done activities at assisted living communities. I worked as a social worker in the emergency room at now Piedmont Athens Regional for 14 years. The interesting thing, we did everything in the ER, but we all kind of had our specialties. So I was a geriatric specialist. I worked for the Athens Community Council on Aging twice. First, I ran their programs for the senior center many years ago. And then I ran their volunteer programs. Then I went to the ER. Then I came back and I ran their adult day health programs, which is a day program for people with special needs, cognitive impairments, people basically who can't be left alone during the day for a variety of reasons. And then I've been with Kimbrough Law for like the last year and a half. And I say that like, it's kind of like all of my experiences have brought me to this place. So just real quickly, kind of what a care coordinator does, and then we'll talk a little bit more about it, but is basically Mr. Kimbrough, who started our law firm, realized that people were coming to him with questions about legal and financial needs, but then they were like, well, what do I do with my mom who just got diagnosed with Alzheimer's? Or what do I do because I'm having a hard time living independently? And he was like, I don't think he did it like this, but I always say he was like, I don't know. So he brought on, so there's actually two of us that are essentially geriatric social workers. And so for our clients, not all of our clients need us, but for our clients that have a care need, we are a part of the team and we work with them. So that's kind of me in a nutshell. So aging in place, what exactly do we mean? Oh, here we go. If there's something to be hard with electronics, it's going to happen to me. So there's a lot of different definitions for aging in place. And really it means that you're making a conscious decision to stay where you are, whether that is independently in your own home, whether you're living with a child, you've moved into a community. There's a lot of different things about it. Basically, I say it's a really nice way of saying, I don't ever want to go to a nursing home if I can help it. And so really the big thing about aging is in place is the safety part of it. That's where people sometimes run into some issues. So we say it's basically where you decide to stay in a certain situation, whatever that habitat is for you, but that you live there safely, independently, and comfortably. And so, like I said, we'll talk a little bit about it, but safety is the part where folks sometimes run into some problems. And not surprisingly, 90% of Americans want to stay at home as long as possible. I think the other 10% are just tired of doing yard work and maintenance. And those are the people who move into a community so they don't have to do that. But maybe that's just me. That's my plan. At some point, I'm tired of doing yard work. So the different options, you can live in your home independently. And when I say home living independently, you can be living by yourself, you can be living with your spouse, you can have a child who's living there, but they're basically, doing their own thing. You can be, there are some people who home share, sisters that live together, but they're not providing care for each other. You can live in home with care. And that can be everything from maybe 4 to 5 hours once a week that someone comes in. And we're going to get into the details of what these are, but they can come in a few times, do your laundry, do things around the house. I say it's not really, but it can be you have a yard guy, and you have a maintenance guy. Those are your traditional cares, not personal care, but that's helping you stay in that house because you're not having to try to figure out how to mow the lawn. And then there's independent living communities. So Terabella is one here in Athens. Those are apartments that you live in independently. They have very small services, like they have meals and they have medication management, but for the most part, you're just living in your own apartment. So the benefits of aging in place, things we like, obviously quality of life, or where we want to be. You are independent. You get up when you get up and you eat when you want to eat and you do whatever it is that you choose to do. This became a big one, of course, during COVID, but in general, you are less likely to catch a bug if there's a bug going through, a stomach bug going through a community. Whereas if you're living independently, you're less likely to be exposed to those things. And like when flu season happens, you kind of can take some, general steps to keep yourself a little bit healthier. Other things that you like, you're in a familiar environment, and can be less expensive. If you don't need a lot of care, it's much cheaper to stay at home in your home than move into a community. So this is why talking about this is important. This is what we all think and hope aging will look like. And for some people it is, but unfortunately it can also look like this, where you might need some help. So this is why planning is really important. And you'll hear me say it time and time again, if you have a plan in place, you come from a position of power. If you don't have any kind of plans in place and then you have something happen, you fall and you break a hip, then you're kind of in crisis planning. Whereas if you kind of plan a little bit ahead, you have a general idea of what you might want to do. It's a lot less reactive. It's a lot less stressful. You can make better choices. You might have a few ideas of where you would go and where you would go to rehab, those kind of things. So this is what aging can look like. So no offense, but I picked this man picture because this is what I hear from the men all the time. It's not going to happen to me. There are some women, but it tends to be the men, and we work with a lot of veterans, and I laugh at them because a lot of the veterans are very fiercely independent, and they're like, I'm never going to need long-term care. I'm never going to go to a community. And unfortunately, the reality is that 7 out of 10 people over 65 will need some form of long-term care. Now, that could be rehab after a surgery or an accident. It could be that they are basically, it's usually a medical thing. Sometimes it could be a cognitive thing where they just can't live independently anymore without some kind of care. So the average length of term is 3 years. And for some people, that could be if they have to move into community, however long they live, could be more than 3 years. So for some people, that could be over their lifespan, it equals about 3 years where they're having a surgery and a rehab and surgery and a rehab. And it easily could cost $100,000 per year. Right now, a nursing home is between $9,000 and $10,000 a month. So this is the care continuum. These are the different kind of scales that you have, and you can see, and it's interesting because your health and your home and the cost, and of course what's available to you is at the bottom, but those kind of all move along. So as you get more frail, you have to do different things to be supported in the home. And then of course, care gets more expensive, the more care that you need. Excuse me. And then down here are some of the public benefits. We're going to talk about some of this. But as you guys all know, everything costs money. So this is kind of what we call the care continuum. So we will look at where somebody is and where they are matches their home environment. So sometimes we'll have folks, so say the person in the little scooter who is maybe still living at home, but their home is not conducive to the scooter. It's not wheelchair accessible. So then that's a concern that we would have because that's a safety issue. How are they getting around? How are they going to get out in case of an emergency? And then the other thing we have to look at, just at our firm, and really what you guys have to look at is what funds do you have? And that is a big component of what, your aging in place journey is going to look like. And then what benefits you may be eligible for. Okay. So supports that are needed. You've had something happen, and you know that you're going to need some help. So the first, and I'm big on this, is the action plan. Kind of have a plan in place. And it could be as simple as, so I liken it to a phone tree. If this happens, I'm going to call this person, or I'm going to do this step. So just kind of be thinking, who's your support in the community? Do you have children that are going to help you? Do you have a friend? Because sometimes you can kind of have things together if you have a plan in place. So COVID was a perfect example. You got sick with COVID. Did you have a neighbor that you could call who would drop off groceries? Do you know how to use an Instacart if you needed something like that? So there's a lot of options available. You just kind of have to think about them. You don't have to put things in place, but you just have to kind of be aware. And that's part of what this class is. What are the options available to you? So the different things that, can help you is there's certainly a lot of information on the internet. It gets a little overwhelming. There are, supports that can help. I heard you guys talking, I was eavesdropping a little bit. If you are in the hospital, the social workers at the hospital, that is their job, is to help you figure out where you're going and how you're going to be safe there. Now, I will say, even though I've worked at the hospital for many years, the hospital is a business, so they want to get you out so they can fill that bed. But they are responsible for making sure that they are safely discharging you. So, and then, obviously money makes everything a little bit easier. And then there, are people, like I was just saying, the social workers, different things like that can help you figure out what the plan should be. Y'all have any questions so far? You guys are very quiet and attentive. Okay, so the different types of support available, and there are a lot. In-home personal care, and again, some of these we'll get a little bit more into detail, but you'll see I just kind of go over everything. So that could be as simple as someone coming in once or twice a week. Sometimes folks just need help with the laundry, changing sheets on the bed. That gets really challenging if you have some mobility issue, if you're recovering from a surgery. Sometimes you just can't pick up heavy things. You can't pick up your laundry basket. You can't pick up your groceries. It could be companionship. I have some folks who really just need, we call it standby assistance, when they take a shower. They're not quite steady. They don't need someone in there scrubbing them, but they're just unsteady enough that we're concerned that if they fall, then that will really be bad. So we have someone we make sure someone's there in the bathroom with them while they're showering. And it can run, in-home care can run all the way to complete care. I have clients who are essentially bedbound, and they have care coming in the home to help them stay at home. So it really runs the gamut. It depends on what you need. You are the person who gets to decide what you need. So I want someone to help me with this. I don't want them to do that. I don't want them to touch my laundry, whatever. Those are your decisions. And then, home and yard maintenance, that's a big thing. Your home accessibility. Can you remodel? Can you redo your bathrooms to make them more accessible? If you get a diagnosis that is going to lead eventually to mobility issues, you need to go and look at your house and see if I end up in a wheelchair, am I going to be able to maneuver around my house? And sometimes it means rearranging some furniture. Sometimes there's maybe, upstairs isn't going to be accessible anymore. The grab bars, the bathrooms are a big thing. So one of the things we do is we do home assessments. I always look at rugs. Rugs are very dangerous, and little dogs. I can't tell you how many people came into the emergency room tripping over their little dog. So, those are things to think about. Automatic lights, that's a big, huge thing, because you get up in the middle of the night to go to the bathroom. You don't want to turn the light on because then you'll can't see, and then it's hard to fall back asleep. So have lights. They don't even have to be on all the time, but that they come on when you walk by. That's a really simple thing that can help folks. You can hire somebody to assess your home. There are senior remodelers, and they'll come out and look at your house and see if there are things, because again, you're looking at the longevity of staying in your home. So while your home is great now, it may not be as accessible a few years down the road. Meals, there's lots of meal options. That becomes really challenging for folks, sometimes standing at the stove and cooking and doing that. The rollators are great for that. I have a client who she just rolls around, sits in her rollator and rolls around to the different kitchen counters. Mm-hmm. You can hire someone who comes in to manage, or that manages all your medical appointments for you. That's one of the things my coworker does for one of the clients. They have some memory impairments. They're still able to live independently, but they've been missing doctor's appointments. So now we schedule their doctor's appointments. We arrange transportation. We call and remind them the day before, some of those kind of things. Transportation, that is everyone's biggest fear. And it is the biggest challenge to remaining independent is if you reach a point where you can no longer drive. And there are some options here in Clark County. The Council on Aging does transportation. Obviously, there's a big fly on the screen. Does Uber and Lyft. Those are, as long as you can get in and out of those yourselves. The Lyft does do a thing, I think it's called Go Grandparents. And you actually pay a monthly fee. And whereas like if a Lyft came to my house, they would just pull up in the driveway. And if I didn't come out after a certain amount of time, they would leave. But you pay this monthly, I think it's like $40 or $50. And then anytime you book a Lyft, you're still going to pay for that Lyft, but that Lyft driver is going to come to your door and knock on the door and help you down the stairs and into the car. And then in the reverse, they're going to make sure you get into your house. So there are some options such as those. Sometimes you'll have, I know I see this a lot in the communities, there'll be someone who's still driving and, you'll pay them $10 and they'll, and I'll see, it's terrible. I call it the clown car, but they'll pull up to like the CVS and there'll be 8 women who get out of this one car and they're all from the same community and they're all going shopping together. These are the things that when I say, know what your resources are and have a plan in place, kind of be thinking about this. Your social connections, if you go to church, if you have a bridge group, especially if you're having a short rehab, nobody likes to ask for help. But if you think about how you feel when you get to help one of your friends, and I try to remind myself, because I never ask for help, but I love helping my friends. And I try to remind myself that when I ask them for help, they get that feeling. So you can kind of, especially if it's a short-term rehab, you can a lot of times just kind of piece together some of your friends, they're happy to do that. If you're talking months at a time, then you may not want to do that. But for some folks, managing their money just becomes just a nightmare. They don't want to have to deal with paying online. I have some clients who are still old school and they go to the power place, they go, and then when their mobility gets hard and they're not willing to learn, the computer and all of that, you can actually hire people who basically manage your money, pay your bills. They meet with you each month and kind of explain, this is, hey, did you know your electric bill was really high this time? And the biggest thing is a positive attitude. And that sounds really trite, but basically we're all aging. And there's nothing you can do about it. So the more you can go in kind of with a positive attitude, the more helpful it can be. Easy for me to say, I know. So the different types of in-home care that we're going to kind of talk about. So there's home care, there's home health care, and then there's private duty care. So, and then there's more, but I'm going to kind of talk a little bit about this. And it gets confusing because home health care and home care are used interchangeably a lot, but they're not the same. So basically, home care is usually through an agency. They overlap, but I guess the big thing to start off with is home care is usually out of your pocket. And home health care may be covered by insurance or Medicare. And I'm going to explain the differences in those. But basically, home care is usually through an agency. They'll do a variety of tasks, kind of what we've already talked about, bathing, cooking. Some of them will take you shopping, to your doctor's appointments. It really just kind of depends. There is not usually a skilled nursing part that goes along with that. So this is going to be a CNA who has gone through some training. I will say anyone who comes from an agency is background checked. Here in Georgia, they have to get fingerprint checked. I don't know about the agencies, but I know when I worked at the Council on Aging, we had to run all of our staff through the system every month because the thought was you can pass your background check and then be naughty 3 weeks later. So we checked our folks basically criminal history monthly. I don't know that every agency does that, but that was part of one of our requirements that we did.
Can you illustrate what you're talking about there?
Illustrate like for home care?
Yes, about contact and behavior or whatever. What?
I'm not sure I understand the question.
I'm okay.
No, that's okay. I want to answer it for you. Like, are you asking about the agency, finding the agency, or what?
I'm talking about the behavior, what is happening that necessitates the agency.
Oh, okay. So like some of the reasons why you might need care.
That's right.
Okay, perfect. So a lot of what we see is a surgery, a fall. People maybe are cognitively declining. Sometimes folks, I have seen this where they have basically gotten off their medication regimen and they start to have, some health issues because of that. And so we need someone to come in and make sure that they're taking their medicine regularly. People in the very beginning of cognitive impairment sometimes will start to not eat well and they start to not take their medicines. And then that causes a host of medical problems. that then once we figure out what's going on, we can really easily fix that. And then, so I guess sometimes I think people think just because you got a diagnosis, you're immediately going to the nursing home. And so I liken it to your diagnosis is A, the nursing home is Z, and there's all these steps in between. So it really depends. Knee replacements, hip replacements, sometimes even just a fall. So I had a lady who fell and she broke both her wrists. So yeah, so those kind of things. Does that kind of answer your question? It's really individual. And I guess really it's almost, I would almost say it's not necessarily one specific incident. It's if you suddenly have something and you think, I'm not sure how I'm gonna do this.
I want to cover it later. This is all assuming we have cognitive abilities to make these decisions. Wonder if we have, for example, a close family member that has passed all the parameters, milestones to need advanced care, but they're not going to do it.
Right.
So maybe they fall, they can't ambulate, they can't get their bed, so they sleep on the floor. They only eat if she can get somebody to come bring her some food. So, but they still okay at home. I don't need any help.
Yes. Yeah. So that gets really tricky. And a lot of it depends on if you have a power of attorney in place, and we will kind of touch on that. We see a lot of that, and it gets really complicated because as adults, if you are competent, you're allowed to make terrible decisions. So I'm assuming you're completely competent. If you suddenly were like, I'm not taking my trash out, I'm going to let trash pile up in my house, we could maybe get code enforcement in there. But unless we can show that you are not cognitively able to make that decision, you can make that decision. So it gets really hard. But if she's not cognitively competent anymore, or he, then if you have some of that legal paperwork in place, you can basically force them into a community. And is it easy? No. Will they be happy with you? Absolutely not. But we have done that where we have been the bad guy. So I have a client who, and it was really hard. I felt really bad for her son. She had Alzheimer's. She probably also had an undiagnosed mental illness all of her life. Her spouse died and things went sideways. And ultimately we had to, what we call 1013 her, which basically means we took away her right to make that decision. And we brought the police and the ambulance in, and we forcibly removed her from the home. And she went to a geropsychiatric facility where she got medicated and treated. She had some health problems that she had been ignoring. And then we moved her into a memory care community. She's doing very well now, as long as she takes her medicines. She can be kind of spicy.
Does she have family?
Yes. Yeah. So, and her son was her power of attorney. And it was really hard for her son because he wanted to be a good son, but he had promised his father he would take care of her. And so it was a lot of education on his part about how this was taking care of her. She was no longer able to take care of herself, and stepping in and doing this was part of that.
And what about people who have those?
Yeah, so those get complicated. There is, or it might not be family local. There is Adult Protective Services here in well, it's everywhere, but they can step in. My experience, I've never been really wowed by Adult Protective Services. So a lot of times they're very hesitant to go in there. And it's kind of one of those things, it's easier with children because children aren't of age. And so even if the child says, I don't want to leave my mom, they can go in there and take them. And I liken it to back in the old days where, a husband could say, oh, my wife's crazy, and commit her. So it's almost like we've swung really far to the other side to protect our rights, that no one can do that. No one can commit you unless, there's proof, but it does make those situations hard. So to answer your question is it depends. And sometimes we try, if we can get a service in that can kind of start supporting that person, get them starting to take their medicines, that maybe makes them a little less paranoid. Sometimes that helps. Yes, sir.
I haven't noticed it, maybe you'll get to it, but exercise and physical fitness should perhaps be on the chart somewhere.
You're exactly right. And I'm embarrassed to say that I don't think I have it on there. And that is a good point. He was saying basically that physical fitness and exercise should be on here as part of your aging in place. And I don't think I have that on there. So that's a really good point.
Because of the pretty dramatic increase in aging population in the course of your career, are you noticing now there actually are considerably more resources available for older people because that is a major market? Is
So
that a positive aspect of the situation?
So the question is, you know, as there's aging population is so large, am I seeing more resources? Yes and no. Cynically, I would say there are more people trying to make money off the aging population. Are there actually more resources that are helpful to people? Yes and no. So COVID really, so we never used to have a problem getting home care. The staffing at the communities was usually fairly well. Didn't mean you necessarily always got the best care at a nursing home, but there were plenty of staff. Since COVID, that's been really hard. It's hard. I have some clients that I really struggle to find a home care aide, especially I have a client in Greene County, it's very rural. So it is a little bit more challenging. So are there more services being sold to seniors? Yes. Is it making a big difference? No. And we talk about this in the office since COVID, is that the staffing has made things really challenging. So yes and no. Yes, ma'am.
And where do you go about finding the short-term care, should you need it?
So to find like short-term home care, hold that thought for just a second. Don't let me forget to come back to it, because I want to explain the difference. Home care comes in with Medicare and private insurance. So let me kind of finish touching on those, but I may forget, so don't be afraid to remind me. Okay, so home care is kind of your agency. Home health care has to be ordered by a doctor. This is something you're going to get mostly if you've come out of a surgery or a rehab. And it's short term. It has a skilled nursing part of it, even if you only see the nurse once. And they will do some of the same things. So that you may have an aide who comes out and helps you in and out of the shower. They may do some light housekeeping while they're there. You may have rehab coming in, physical, occupational, speech, whatever it is that goes along with whatever your illness is. So home care and nursing care, again, just has to be ordered by the doctor, and there has to be a skilled nursing part of it. So sometimes folks who are getting wound care, sometimes folks who are on infusions, those kind of things. But just remember, home health care. So home care, you can have home care as long as you want, and as long as you can afford it. Home health care is going to be short term. And then there's private duty folks that will come in. Those are usually folks you pay kind of under the table. A lot of times they have also gone through special training, screenings. That's something you want to be sure before you let someone come into your home. The thing with private duty care that's different than home care is you take on the liability of if something happens to them while they're in your home. So under a home care agency, I come out to your house, I trip over your dog, I break my arm. The agency has liability insurance. They're going to take care of that. Private duty person comes out to your home, trips over your dog, breaks their arm. You have the possibility that they're going to be like, you have to pay my medical bills. Okay. So that's one of the big differences between those two. You may get hospice care. Hospice care is more toward end of life. There's the 6 months thing, but obviously nobody knows really when anything is going to happen. I do have some clients that have been on it for longer than 6 months. You're going to have a nurse that comes in once a week and checks on you. You're going to have an aide that comes in and helps. Usually folks on hospice care need more help with personal care, bathroom, showering, all of those kind of things. Palliative care is similar to hospice care, but not quite as intensive. So basically, palliative care is for any stage of a serious illness. They're usually going to come in once a month and kind of check in on you. Both hospice care and palliative care are going to be able to help with pain management. That becomes an issue for some folks when they have a chronic problem. The other two are companionship. That is where, and I don't see this one as much, but that's where basically they're just going to come in and spend time with you. It's exactly what it sounds like. So they may do a little light meal preparation, but they're not necessarily going to be showering the person. You know, we see that sometimes where someone maybe has a paid companion who comes and takes them to events at the Museum of Art and is with them there throughout that whole thing and then takes them home. So it's much more of just kind of a companion thing. And then respite care is usually fairly short term. So that's going to be for a family member. I have a family member who's going out west for a wedding and her husband has dementia and can't be left alone. So he's going into respite care. She has every expectation that she's going to come home and take him back out of that community and he's going to come back home with her. Hold on that one question. Do you guys have any other questions so far? Okay. All right. And then there's the family and spouse caregivers. This is the most common caregivers. So you can see the numbers there, 34.2 million Americans have provided unpaid care. On average, they spend almost 25 hours a week. So if you think about this, so the children who are caring for their parents who have a cognitive impairment or have a physical limitation, they're working 40 hours. And then they're also providing almost 25 hours of unpaid care. And then the other thing that I think people sometimes forget with their families is that you also have to remember that if that person is not working because they're taking care of you, that is really lost income for them. A lot of them are happy to do it, but it is something that you think about. People are like, oh, my daughter takes care of me, so it doesn't cost anything. It does. There is a cost to it. It's just not something you're paying out of pocket. So nearly 1 in 10 caregivers are 75 years or older, and that's usually because they're caring for a spouse or an older sibling. And interestingly enough, so I always say the caregivers can't see the forest for the trees. They get so busy taking care of the person, we call it their care recipient, but basically whoever they're caring for, that they neglect themselves. And interestingly enough, sadly enough, 30% of them will die before the person that they're caring for. So in my job, it's always interesting because I have a couple that I say, he has a memory impairment. She is completely fine. He is my client, but she's really my focus because she's the wheels on the bus. And if she gets a flat tire, then everything changes for him. So I do have a lot of couples that I tease them that like the two of them together make a whole, but on their own individually, neither of them could probably stay independently without the other because they provide care for each other. So this is probably the most common that you'll see of the caregiving. So the technology, there's so much technology now, but you really have to look at what's going to work for you. Is it really a benefit? So there's wearable technology, the emergency call buttons. There's actually now, I haven't seen it in use, but I've heard about it. So, you know, the falls, there's actually, it looks like a smoke detector, but if you are beyond a certain spot in your house for more than like a minute or two, it automatically calls 911. So it actually recognizes if you're on the floor, because here's what happens. People leave their pendants. Oh, I don't need this right now. It's bumping against my chest. And then they fall and they can't reach it. So this new technology is basically, it's almost, I liken it to, you know, the old spy movies where they had the red laser things and the people were in the art gallery. It's like that. So if you're below a certain spot in your house for a certain amount of time, it automatically calls 911. So there's no sleeping on the floor with that particular one. You know, Alexa is great for people with beginning stages cognitive impairments. You know, I don't know if you guys have anybody who has a cognitive impairment. What day is today? What time is it? What time is it? What time is it? And it'll make you batty. So we set them up to ask Alexa, what time is it? Or, I have one caregiver who, rather than have her spouse call her, he asks Alexa, what time is Rhonda coming home? Rhonda will be home at 2:00. What time is it now, Alexa? It is 1:00. Rhonda will be home at 2:00. So just little things like that. And I think where sometimes caregivers get stuck is they just don't want it to be that way. Like, I don't want to have this, but the reality is this is their disease, and these are things that can help you. So the video connections, you can Zoom and Skype. I think that became really obvious during COVID. Telehealth appointments, that's helpful for folks who are having a hard time getting out of the house. Security systems, kind of same thing as, the wearable technology. These medical dispensers, these are super cool, but they have their limitations. So this one over here is called the Hero, and it basically dispenses your meds, whatever time you set it up. You just drop the pack in there. They come packaged. You drop the pack in there. It spits out your little pills into a cup. And if you don't pick up that cup, it will send like an alert to either your phone or your child's phone. And so we thought that was the greatest thing. We had a client that was having some memory impairments, and we were like, this is brilliant. This is going to work for him. And it worked for a while. And then she would call him, hey, Dad, you didn't take your 2:00 meds? And he would be like, oh, okay. And he'd go over to the Hero. But then as he got worse, we realized he was picking them up and thinking, I'm going to the kitchen to get some water, and then would forget what he was doing and set the cup down. So they are limited, but they are really helpful. And it'll set an alarm, and you can even do it just to yourself. If you have, I know some folks will be on very time sensitive medical or medicine regimens. So that can be really helpful. Remote patient monitoring. They actually have companies that you can pay to do that. The camera system. So I can never bring this up without telling the story. We have a lady who is got some early memory issues. She's still living independently. Her children have cameras in the house. She knows there's cameras in the house. When she gets mad at them, she goes around and unplugs them all. But they have like one or two like hidden. She has not figured out where they are, but she will and the daughter says she will just look right in that camera and then they're gone. So when she gets mad about something. And then we already talked about the automatic lights that come on and off. Those can be really helpful. So things to consider about aging in place. Is your home able to be renovated if it needs to be? And is it worth doing that? Sometimes, if eventually you're going to sell your home, a wheelchair ramp is great to have, but it doesn't really add any value to your home because most people aren't going to move in thinking they need a wheelchair ramp. So those are things to think about. 4 out of 5 older adults have at least one chronic health condition. So if you have a diagnosis, and hopefully you are, years away from having any real significant issues, but just think about that. So maybe you have a diagnosis of congestive heart failure, and right now you're fine. But that if you get worse, that's going to cause issues walking up the stairs. It's going to be shortness of breath. Whatever your diagnosis is, be kind of thinking ahead. And how is my house that I'm in right now manageable? Is it manageable? Am I going to be able to, if you live in an apartment and you have to carry your groceries upstairs, how long are you going to be able to do that if there's not an elevator? So have support in case of an illness or an accident. Have an emergency plan in place. I cannot tell you how many older adults that I saw who came into the emergency room and were refusing to be admitted because I'll never forget this. I don't have anyone to take care of Taco, which was this lady's Chihuahua. And that was her family. I mean, that was really important to her. And she was in a full panic. I have to go home. And I was like, if you go home, you're going to die. You have to stay. And luckily we were able to reach out to her church, and we found someone who was very happy to take care of Taco. But just kind of think about those things. So I have 2 children, but I am divorced. And so IT is my best friend. She is my emergency contact. But she lives 40 minutes away. So, those are just things you have to think about. There are people, we call them solo agers, where they do not have a spouse anymore. And maybe they have children, but their children are not close by. So have someone. So like I said, I've had a conversation with my best friend, I'm going to call you And, and then here's my kids' phone numbers. I might need you to come immediately to the hospital, but here's my kids' phone numbers, here's my sister's phone numbers, they all live out of state. But I have that one person who I know I can call, especially like if I'm going into surgery or something, I know is gonna, at least start my phone tree and get things started. So think about those things because it's called an emergency for a reason. It's not a planned event. It's not something you necessarily thought were happening. Transportation, we kind of talked about this. What if you can no longer drive? Where do you live? I live in Statham. That's going to be a huge problem. It's going to cost me $30 just to Uber into Athens. So that would be something that I would have to think about. And it might be, maybe I sell my house and I move into Terabella in an apartment living or independent living where they have a van that I can, and I could, if I'm in good enough physical shape, I could walk down to the Kroger and get one of those little carts. So there's just things you have to be realistic about. Finances, care can be expensive. What are your finances like? How easily kind of accessible is some of that money? And then loneliness. What if you can't drive and you're stuck in the house? And I think we always underestimated that until COVID. And to me, it's not enough to just Zoom. I noticed when we closed the day center, we did Zoom calls, we did driveway visits, we did a lot of things, but I did it. I had one client who lived alone and she said, I just want to hug you so much. And I know that she hadn't been to the center at that point, it had been 2 months. And I was like, you know what, give me a hug, because I knew that was going to be healing for her. So that is one thing to think about. It's not just, can I call somebody? Can I see someone on screen? It's that actual, having lunch with somebody. Those are really important things. Okay, so when is it unsafe to remain at home? This is a conversation. This is kind of what you guys are talking about. This is the conversation we have a lot, and we have a lot of differing opinions. This is sometimes we're having a outside person come in. I've got no dog in this fight. I don't bring all of the, baggage to this relationship, because I'll tell you, if someone knows how to dig the knife in, it's going to be someone who's close to you. Like they know exactly where to, get you. And that's just part of human nature. I don't have any of that. I'm kind of an independent person. I'm going to give you my, opinion. I have a lot of experience. I unfortunately can't make you do anything, but sometimes I can sweet talk you into it. So the concerns, safety, condition of the house, we'll see a lot of this when folks can no longer do the maintenance themselves and they don't have, it's hard to find a reliable maintenance person that you feel comfortable coming into your home. Can you still manage the stairs? Can you manage the stairs with groceries or laundry? That's really the thing. So people will be like, oh, I can go up and down the stairs. And I'm like, well, how are you going to get your groceries in? And then safety, are they confused? Are they wandering? That's really a huge thing for a lot of folks. Are you unable to cook independently? To me, this one falls right up there with your physical fitness. If you can't eat well, your health is just going to decline. It just is. Doesn't mean that you have to be able to cook great meals, but if you can get out, we used to, when I first started at the hospital, everyone came to the cafeteria for lunch or meals. And we would see a lot of the solo agers, they would come in and they would get their dinner and then they would also get something to go, and the staff knew them. So they were like, oh, here comes Mr. Joe, get extra green beans, whatever, so they had that connection. They were eating real food. Falls, once you start falling, that becomes a big thing. That's where physical therapy can be really helpful. Put your pride aside if you need a cane or a walker. Like I tell my clients, suck it up, buttercup, because it's going to keep you from falling. Bathing challenges, getting in and out of the tub, that stepping over the tub. And there's a lot of things that you can do. You can get a shower chair. You can redo your bathroom so you have a kind of a walk-in shower. There's a lot of things that can be done. But sometimes finances, sometimes pride, sometimes not being able to find a maintenance person, those all make things hard. And when you're looking at these, you also need to look at, is it in my best interest to maybe sell my house and move to a community that has laundry, that has, aids if I needed help. Maybe you move into an assisted living and you don't have any care needs. That's great, but eventually you're going to. So, laundry challenges. Obviously, some real concerns will be, more care means more money, most of the time. Can you manage the technology? That hero is great if you can figure out how to do it. And not everybody can figure out some of this technology. Is it unsafe for you to live alone? That's really what it comes down to. And so I think a lot of people try to stay at home too long and then they run into some problems. They get hurt much more than they would have. These are the people, unfortunately, I am kind of gloom and doom, aren't I? These are the people who fall and are on the floor for a couple of days before they get found. Then they have a whole host of medical problems that go beyond just their fall. Lack of transportation, you can't get to the grocery, you can't get your medicines, you can't get out and see people. People can't see you. Medication management. How are you going to, are you still able to take your medicines the way you're supposed to? And then the loneliness and isolation. Okay, that was depressing, wasn't it? So here are some of the different residential supportive care environments. So there's Continuum of Care, that's like Presbyterian Village. Celebration Village is going to be a new one that they're building out kind of near Home Depot. Those are the ones that you buy into. You pay a large amount of money to move into that community with the understanding that you will, even if you end up needing nursing home care, you will stay in that community and they will take care of you. So usually like Presbyterian Village they have cottages, they have independent apartments, they have assisted living, they have a skilled nursing care. The nice things about those is if you need rehab, you don't have to leave your community. You can go to rehab, stay on the rehab floor, and then move back to wherever you were. They are very expensive. The only other thing that I warn people about is that make sure that if you join that community, that you are committed to staying in that area. So staying in Athens. I have a gentleman that I was talking to who was looking at one, but his children are, his son is a professor, but is probably going to get a job in North Carolina. And I was like, well, because you can't really get a lot of your money back. Celebration Village says that you will. I'm not really sure. It hasn't opened yet. But for that gentleman, it didn't make sense because I was like, well, then you're going to be here in Athens, even if your grandchildren who you adore move to North Carolina. So it's just things to think about. Assisted living communities. Of course, there are independent apartments like we talked about Terabella. Assisted living communities, those can be completely independent cottages. A lot of them are apartments and they may layer in care. So if you're looking at assisted living, one of the things I always tell people is ask what like your highest level of care cost is. So some of the assisted livings will say, oh, we're $3,500 a month. That sounds like a great deal. I get an apartment, I get laundry, I get meals, but then you have to look at each time you move up a level of care. Okay, now I need someone to bring me my medicine. There's a bump in cost. Now I need someone to bathe me. There's a bump in cost. So you just want to make sure, is it all inclusive? So some of the communities are like, this is what you're going to pay. And even if, you need total hands-on care, this is the most you're going to pay. So just be aware of that. Within a lot of these assisted living communities are memory care communities. So those are traditionally locked down communities. Those are folks, but Arbor Terrace in the Orchard has where like the mid-level folks can wander around the community, which is nice, but they can't actually get out. I mean, I hate to say it that way, but that's kind of what it is people get confused. They get confused where they are. They think they're visiting someone. I got to go home. So the memory cares, and then those are going to be where those staff have special training to help work with people with memory impairments. You can have physical limitations as well, but it's really mostly the memory impairment. And then your skilled nursing communities, those are basically nursing homes. So there's several of those here in Athens as well. Some of them have rehab, some of them are just long-term care. Those a lot of times are going to be folks who are really medically complex, maybe don't have the funds so basically these first three are private pay. So sometimes folks end up in skilled nursing care because they don't have the money to pay out of pocket. Usually like folks when they reach a point where they're bed bound. So for most of the assisted livings, you have to be at least able to stand up and pivot. So like go from, with help, get out of your wheelchair and pivot and then sit down on your bed or whatever it might be. So if you reach the point where you are pretty much unable to stand and pivot, you're gonna be potentially looking at nursing care. Yes, sir.
I know this is a very difficult question to answer, but can you kind of give cost ranges between those facilities?
Sure, so, the continuum of care, I'm not as sure about. I would say they are, like a down payment is $50,000 plus to make your initial, payment, and then you pay a monthly charge. Now, there are a couple that are different. Crestwind, you actually buy your house, but say Presbyterian Village, Lanier Estates up in Gainesville, you are basically putting in a big lump sum of money, and I really want to say it's probably in six figures.
It is.
But I'm not sure. Yeah, so I didn't want any of them to come back and be like, you said it wrong. So yeah, I do think, thank you. It's six figures, you buy in, and then you pay kind of a monthly rent, which covers your meals, and then that, that may or may not go up as you go into skilled nursing care. So the thing with continuum of care is that the idea is if you run out of money, they will not put you out. You have paid this big amount to come in, and if for some reason the stock market goes crazy or something happens and you run out of money and you need, a nursing home, they're going to keep you. That's the part of the premise of that. And that is, they really put themselves as the aging in place communities, that you never have to leave that community. Assisted livings run anywhere, depending on your level of care, probably from about $3,500 to $7,500 a month. Usually assisted livings are going to cover, they're going to provide transport on certain days, like to doctor's appointments, some of those things. They're going to do trips, 3 meals a day, medication management, a lot of it, care needs, just kind of depends. I guess with assisted living to know about is things like related to your health that are not going to be covered, are going to be like if you use incontinence items, some of those kind of things, that's not going to get covered in that cost regardless of what your level of care is. Memory care communities are usually in assisted living communities, so that cost is a little bit similar, but their memory care is usually a little on the higher end. So like if you move into assisted living and paid $4,500 a month, and you were like probably any of you in this room, but if you moved into a memory care in the same community, it might be $5,500 or $6,500 because those folks need 24-hour care. And usually memory care is all inclusive. So if you move in a family member who is still walking and talking, but is no longer able to live independently, is, just a wandering risk, even if their disease progresses to the point that like they have to be fed, they can no longer feed themselves, that cost doesn't usually change. Skilled nursing care, out of pocket, $9,000 to $10,000 a month is pretty much any of them. And it doesn't like $10,000 doesn't mean you're in a better community. That is just kind of the going rate for most of the skilled nursing care out of pocket. Yes, sir.
How versatile is something like long-term care insurance, Mass Mutual or
I think we're going to come to that. I do talk about, we're getting ready to talk. If I forget about long-term care, particularly remind me, and I haven't forgotten your question because we're getting ready to come up to Medicare. So how to pay for all this. Okay, so Medicare, people get a little confused about Medicare. Medicare is short-term help. Medicare does not pay for a nursing home. So Medicare was really designed, I don't know, many years ago when folks weren't living as long and they wanted people to be able to get back to the workforce. So really, I think of Medicare as a rehab. So it's not going to cover any home modifications, not going to cover, when I say long-term care, I mean skilled nursing care. Medicare will cover, it may cover your medical equipment. So I have a client who needed a Hoyer lift because he can't stand on his own, he lives at home. They paid for the cheapest one. It may cover some of your medications, and then it gets more complicated depending on what Advantage plan you have, what supplement you have. But always remember, Medicare is short-term. So if you have a fall and you end up in the hospital and you're going to go to rehab, build up your strength. Medicare is going to pay for a certain amount of days, and I have that in here in just a minute, but it is not going to pay for you to, if rehab does not go well and you now have to stay in the nursing home because you just can't safely come home, Medicare cuts off at a certain time. I don't have the date, but we work with, so when Medicare open enrollment happens, you have a couple of options to talk to people about what makes the most sense for you. Never pay for that. That is a free service that's provided by supplemental health insurance policies. It's through Georgia. Georgia pays for it. So what happens is when Medicare open enrollment happens, is there are insurance companies that they get money to sell you certain insurance or certain advantage plans. Georgia Cares at the Council on Aging, and then we work with Affordable Health Solutions. They can help you kind of talk about your situation. This is what I have, this is what's going on, what's a good supplement for me, these are the things I want dental care, I don't care about that. But we are also doing a webinar about like the 5 most common mistakes made during open enrollment. So I just put that up there because we just got that scheduled. So that's Medicare. Now, Medicare, some folks will notice like, it'll pay a lot of your medicines. You have to pay the premium in the beginning. Medicare is a complicated beast because it really depends on what program you have. Medicaid is really for folks who are low income. And you can plan ahead, and I'm not going to get too much into this because I know we did it during the when the attorney was here, but Medicaid has a 5-year look back. So there are things you can do to plan ahead and protect your assets. Otherwise, basically you have to spend down all your money before you would qualify for Medicaid. As a single person, you can only have $2,000 hard stop to be eligible for Medicaid. So a lot of what happens sometimes is people end up going into a nursing home. They don't plan it. Never going to happen to me. It happens. They have to spend all of their money, especially so for me as a single person, I would have to spend all of my money until I only had $2,000 left in order for the state to start paying for Medicaid or start paying for my nursing care. So Medicaid can be helpful. Medicaid only pays for skilled nursing care. It's only going to pay for you to go into a community. There is, or not a community, a nursing home. There is a waiver program for folks kind of the middle income that can Medicaid. So basically, it's better for you, cheaper for the state for you to be at home. So there is a Medicaid waiver. It's called the Elderly and Disabled Waiver Program that sometimes people in the middle income fall into, and Medicaid will actually pay for some of these supportive services, Meals on Wheels, Adult Day Center, home care, to help try to keep you in the home. So that gets really complicated, and it gets complicated based on income and all of those things, but I'm happy to talk to anybody afterward. Private pay everything out of your pocket. While until you run out of money, and then you look at Medicaid. Private health insurance. This also applies to your Advantage plans. Make sure you read it very carefully to understand what is covered and when it is covered. Long-term care policies. So you really have to read your long-term care policy and see what it covers. So most of the long-term care policies will cover home care, part of it. It will cover usually they have a set amount. The last one I looked at, I have a client I'm working with, they get $158 a day. That's hard stop. They're going to use it for home care because they want to stay at home. But if they eventually have to move into assisted living, it's $158 a day until they use up however much money they have in their policy. Be sure. Oh, do you have a question? Okay. Be sure and look at your policy and figure out what your elimination period is. So basically you have a set, all of these policies come with, you have a set amount of time that you have to pay out of pocket before the policy kicks in. Unfortunately for my clients, it's 90 days. So that's something that they're just kind of having to understand. One of the things that I say all the time about long-term care policies is do not wait too long. Everyone, I think it's because we don't know how long we're going to live. And so it's scary to think you may run out of money. So people will sit on these long-term care policies that they've been paying on since maybe they were 30 or 40. And they will be like, I'm afraid once I start using it, it's going to be all gone. And I have seen a lot of clients who start it, get through their elimination period, and then they die long before they get their money back out of it. So this is definitely a use it or lose it kind of thing. Once you get through your elimination period, there's no, and I may be getting in the weeds, so forgive me. You don't have to use a certain amount of services. So for my clients, I said, once you get through those 90 days, even if you get to where you really don't need home care anymore, we're going to keep having someone to come out 4 hours a day, once or twice a month, even if we have to, because we've already paid those elimination periods. We can keep it up without having to restart the clock, if that makes sense. But a lot of it, it's complicated. You got to read your policy, ask questions. It's hard to get answers on the phone because it's an insurance policy. They've been taking your money for years. And if you don't use it, well, that's a win for them. So that's my soapbox about long-term care policies. Yes, sir.
I don't see, VA.
It's not done yet. Hold on. I'm
Robin?
getting
Okay.
okay, hold on.
Robin?
Sir, ma'am, yes. Who's calling?
Sorry, it's Amanda from the Zoom room. I had a, I had a question in the chat box, I think from just a couple slides back when you were looking at some of the different institutions, memory care, that sort of thing.
Okay,
The question, was, is the fee for these institutions for just a single person or a person and a spouse?
so it depends. It's not, it's usually if it's a person and a spouse, then usually what they'll do is essentially it's two separate people, but sometimes they'll knock off $1,000 a month. So it's not like an apartment where if you move in, you pay $800 a month, whether there's just you or whether there's 4 of you. They do count it per person, but sometimes if it's a spouse, it'll be like the first person would be maybe, $6,000 and the second person may be $4,500, $5,500, something like that. They do knock off a little bit. That it? Okay, perfect. No wonder I couldn't figure out where the voice was coming from. I thought I was losing my mind for a minute.
Be very careful. Your voice was
I know, everybody's watching. So Medicaid and Medicare is like comparing apples to oranges. They're two completely different things. I don't know why they named them the same thing because it gets really confusing. Yes, but they are. So I say Medicare is short-term care. And that's about all I've got out of that. I've tried to come up with some fun little word thing to help us. So does Medicare pay for long-term care? No. We've kind of talked about that. I tend to get ahead of my slides. So it's rehabilitative. It's 100 days in skilled facility, but don't let that fool you because that 100 days is not 100 days covered by Medicare. So the way it works is usually days 1 through 6 is like a $1,600 deductible. For most people, they're in the hospital. There's something that's happened. You're in the hospital. That Medicare is billed by the hospital. And then afterward, you'll start paying after, I don't know if I can see. Hold on, let me move this. I can't see my note to myself. Yeah, usually 6 days, 61 to 90, you're going to have a $400 copay, daily copay. And then it goes up to $800. And then after 100 days, if you're still there, you're going to start paying out of pocket. Or if you have a private insurance, then that may also kick in kind of alongside. So that's where it gets confusing, I think, to people because they'll be like, oh, well, my neighbor went to rehab and they didn't pay anything. But then this neighbor on the other side went to rehab and they had to pay, $4,000. Depends on what you have. But that's pretty much what Medicare is going to do. We talked about this. Home care is limited. It's going to be ordered by a physician. You have to be homebound. That one's a little gray. But care has to be by a professional either. So the RNs will oversee the CNA that comes out. But you may have PT or OT come out. Now, one thing I will say, especially about PT and OT. So if you go home and you are getting PT and you're showing some progress, as long as you're showing progress, they can a lot of times keep it going. But as soon as you've kind of plateaued, then usually PT has to stop. And so what I tell some of my clients, and then of course what happens is, so I have this one particular client, he has been working with walking with a walker. He's been building up his strength. He's doing really good. PT ended. And of course, within a week or two, he's not doing the exercises anymore because no one's coming out to make him do them. So he's starting to decline again. So I told the daughter, reach out to the doctor and get the doctor to redo home care. So sometimes they can do that. Sometimes Medicare is like, no, it hasn't been long enough. But if they decline enough, PT will come back out and you can kind of keep doing that cycle for a little bit where Medicare is paying for it and you're still getting rehab. So that's my little work of the system. Uh-oh, I got stuck. All right, so does Medicaid pay for long-term care? Maybe. It's gonna be skilled nursing care, nursing home only. They have to be a Medicaid licensed facility. Not all of them are. Usually you do not get a private room. Now, I do have some clients who are on Medicaid in a nursing home whose family pays an extra, I think it's like $1,500 a month, and they do have a private room, but not every community will do that. And it's what we call a Medicaid bed. So do they have a Medicaid bed available? Sometimes you will hear people leaving the hospital and going, we had a client who ended up in Tucker, Georgia, because that was the only place that had a Medicaid bed. So that does happen. Doesn't mean that person can't eventually transfer back, but if you're leaving the hospital, again, remember the hospital wants that bed open. They're going to send you wherever there is an open bed, and it may not be in Athens, especially if you're on Medicaid. Does that make sense? VA. So the VA, this particular slide is about the pension program, which we've talked about. I'm going to just really lightly touch on it. I'm happy to talk about it more. We have those things, but there is also the VA health benefits. So if you were a veteran of any time, you can access the VA for health services. Do you go to the VA? You don't mind my asking? No. Okay.
No, I don't, but I wanted to cover it because
Yes.
it's somewhat similar to Medicaid, but it's featured for veterans.
The VA gets a little complicated, and those are like rabbit holes that I have gone down trying to get answers. But basically, everyone who is a veteran is eligible for healthcare services. But then they look at your income and what your co-pays might be and all of those kind of things. So a lot of times I have to tell my veterans, I don't know how much you're going to end up paying. It's almost always worth it if you are having expensive medications. I have one client who is on a blood thinner. He was paying, I think, $200 or $300 a month. He went to the VA and now he's paying, I think, $70 a month for that one medicine. He chooses to not use the VA. He kept his own doctor, but he has to go every year for a physical. So the VA does do some limited home care services. That gets even more complicated as far as finances go. And some of it, and then if they have, obviously, if they have a service-related disability, then they don't pay anything for healthcare there. There is a clinic in Madison County. So not everybody has to go, and there's one in Oakwood. So it's not like they necessarily have to go to the big hospitals in Atlanta or Augusta unless they need surgery or something. Oh, yeah.
I had a friend who went to the VA, excuse me, and got his hearing aid for free.
Yes.
Now, I don't know what the situation was with him.
Right. So the hearing aids, that one gets a little tricky. So look, I love our veterans for having served. I do not love the VA for how they take care of our veterans. I'll be real honest about that. I say the VA says deny till you die. But the hearing aids gets really tricky. And I've done a lot of research because I've had people get them. I've had people not get them. So basically what the VA says is that if they can determine that your hearing loss was probably related to the work that you did. Well, imagine, all of the veterans now, when they were young, they were out, nobody wore protective hearing, nothing. But like my one client who got denied, he worked at General Motors. So they said, oh, well, you worked in the factory. That's what caused your hearing loss. So it gets complicated. I tell any veteran to apply, and try. And that's really all you can do. So it does get complicated. So it's kind of like if you worked on the boat and then you worked in an office job and they can't find any reason to pass your hearing loss off, then you get free hearing aids. But if you at all may have worked in a job that could have caused hearing loss, you're going to get denied. So it gets really complicated. We personally don't do beyond this pension, but Silver and Archibald here in Athens is the go-to for VA questions. But so this pension program, I bring this in because this is money available that the VA doesn't tell you about. So for our veterans who served during specific war times, and I have them there, and I'm not going to go into great detail, But you can, if you are a married veteran and you meet the dates of service, you meet some health requirements, and this is, you have grab bars in your shower, maybe you use a cane. And there are some financial requirements, but we have ways to kind of adjust those. A married veteran can get $2,642 tax-free every month for the rest of their life. And the VA doesn't tell a lot of folks about this. Where this comes in a lot is for folks who are needing care. So a lot of times folks who are like, oh, I need to pay someone to come into my home, or I need to move into community. This is one of the things that we explore, is whether, you know, and the surviving spouse, if you were so legally married to a veteran when he passed away, the surviving spouse is eligible for $1,432 tax-free every month. It's a lot of money. Okay, we're gonna really quick go over estate planning documents. I work at a law firm. I can't not say these are things that you need to have in place. And this kind of goes to your question about people out of state, or you, as far as like when can we step in? So it's really important. The three most important things, that everybody have. Let's see what happened. Maybe I need to. There we go. Sorry. A last will and testament. A durable power of attorney, that's your financial power of attorney. Advanced healthcare directive, that's your living wills, what they used to be called, where you make your health decisions. If you die without a will, basically Georgia decides who gets the property or how your property gets divided. Everyone thinks your spouse automatically gets everything unless you have done certain things. It is not the case. So plus, if you die without a will, it gets complicated for probate. If you have an estranged child, we have to track that person down. It's just harder. So, and then power of attorney. So this is going to be your financial power of attorney. You suddenly are no longer competent. We have this, actually, we have a gentleman whose wife had surgery and she had some unexpected complications and had a major stroke and is no longer competent. He can't sell their house because both their names are on it, and he doesn't have a financial power of attorney for her. So we are having to go to the court to petition for him to become her guardian. We had to reach out to her children and get their approval to do this. He is going to have to report to the court. Sorry?
Just one question about the power of attorney. Doesn't it have a due by date? I mean, it's not forever. Right?
It ends when you die. Yep.
The day you die.
The day you die.
And
that
just a comment about that, if that person has continuing expenses and it takes the executor several months to become sworn in, how do you pay?
right. So that's when you come and see us, because what you do, and I'm doing this actually, because I did all of my documents, you can put pay on death or transfer on death. And then when you die, like for me, one of my children will automatically be able to access, or you can already be on there. There's things to do, yes, to try to avoid those situations, but you're exactly right. As soon as you die, your power of attorney is no longer valid. So, and the reason for this is because, you know, who wants to have to go to court and petition the court? It takes a while, it's expensive. Then you have to do a financial report every year explaining how you are not misusing this person's money. So if you can get a power of attorney ahead of time, then that can be really helpful. Advanced healthcare directive, a lot of folks are familiar with this. This is where you name your agent to basically make decisions for you healthcare wise. You do have in there where you say what your wishes are, but you're basically assigning someone to make that decision for you. I always say, having worked in the ER, this is the greatest gift you can give your children. It's really hard, especially if your children are not in agreement or you have any kind of family issues. In that moment, when the doctor is saying you have to make a decision and you haven't already had that conversation, or one child is like, you know, do everything, and the other child is like, no, I know mom didn't want that, but there's no paper. If there's a paper, the doctor can say, look, you know, Bruce's daughter who says Bruce didn't want anything is the power of attorney, so we're not doing anything. So that's why that's important. Life care planning, we kind of talked about this in the beginning. This is what we do. It's a holistic approach. So what we do for our clients is they actually sign up with us for a year. They have unlimited access to us. We try to set up a plan of action, put things in place before anything happens. And then as, you know, if you have a crisis or something like that, we can help you. So why is all this important? You know, is basically we are able to maximize your resources. We talk about what's important to you. For some folks, it's really important that they leave money to their children. That's the most important thing. The kids might be like, Mom, I don't want your money. I want you to take care of yourself. But we try to balance and try to meet the need of the client. The caregivers, I'm a resource for them. That's probably the biggest thing. And then the families have the peace of mind. So kind of like you were saying, I have several clients whose families live out of town and I'm the boots on the ground. I have a gentleman who's 93 and he lives alone and his birthday's coming up and he and I are going out to lunch. We have lunch at least once a month. And then I just send his daughter a little note or I take some pictures of us together. He's doing pretty well, but it just reassures her that he is okay and that, you know, someone is looking on it. And basically, you know, of course, I put life care planning on there, but really you want to be in the driver's seat. You want to make the decisions that you want and put the plans in place that you want when you're not in a crisis situation. So kind of here's your aging in place checklist, evaluate your finances. You know, if you want to create budgets, but just kind of have a general idea. Home care, private home care right now is anywhere from $25 to $35 an hour. Because of the COVID shortages, some of the agencies are requiring like 6 hours a day, minimum 2 days a week, different things like that. Some of the private duty folks only charge $15 an hour, paying out of pocket, which is fine for a lot of folks. You know, consider meeting a financial advisor. Those are good ones if you have a long-term care policy. Understand now what your long-term care policy covers and doesn't cover. Sometimes those, if you end up in the hospital, you can use that as your elimination days, which means you don't necessarily have to pay out of pocket for those. So really understand your policy. Talk with your family. How much support can they realistically provide? Everyone likes to say, oh, I got you. But, you know, you can look at your daughter and know that she's got 2 small children and she lives 45 minutes away. So realistically, how much can you count on her? How much does she want to be there? But what is the reality? Identify, you know, oh, I wrote that wrong. I wrote medication, not. Anyway, sorry, I have a typo in there. You know, look at your projects, your home projects, get professional estimates. You want to do things, if there's things that need to be done to your house, you want to do them before you're on crutches. And then you don't feel well, you're on crutches, you're having a hard time. And now the people are coming in to renovate your bathroom. So if you can plan ahead, that's a really good thing to do. Assess your current health, future needs. All of us have, you know, but remember too, what I always say is like, we use it mostly with Alzheimer's, but if you've met one person with Alzheimer's, you've met one person with Alzheimer's. So just because your mom had COPD and you maybe have it, you are not necessarily going to age in the same place as she is. So I just say that in that, you know, don't let it like wear you down if you have a family diagnosis and your parent may be aged very differently than what you hope to age. Come to terms with your level of independence. That for me has been coming to terms with my support system, which is fairly small because I don't have a family. My oldest son is 22 and he unfortunately is my power of attorney. And my younger son teases him because like, he's like, oh, I'm doomed if mom dies, you know? But that was, you know, I mean, and maybe that's too much information, but that was a big thing for me is like, I just don't have a big family. I don't have a big support system. So I have to be honest about that and what it might look like if something happens to me. See what services your health insurance will pay for, especially your Medicare Advantage plans. So I had a client, I didn't realize this until I called the home care, that her Advantage plan will actually pay for a few hours of home care service. She didn't know, I didn't know, I didn't even realize that they had started doing that. So it's really good to know, have a general idea at least. Speak with an elder law attorney, make sure you have your estate planning documents. If you want to do asset protection, you know, figure out how to protect your assets because there is a 5-year look back for Medicaid. And then we also do that VA pension if that might be something. Explore the nonprofits. and government resources in your area. So here in Athens, we're a little luckier than some of the other communities because we have the Athens Community Council on Aging. They have a large Meals on Wheels population or service. They have a senior center. They go on trips. They have transportation. So there are things that are available. You just need to know about them, know what they are. Consider transportation options if you can no longer drive. Do you live on the bus route? Would you know how to ride the bus? Not this girl. I've never ridden the bus. So, things like that, and I suggest to families, like if you live on the bus route and that might be an option, go ride the bus now. Not when you're hurt and you're scared and you're trying to figure out how you're going to get to the grocery. Just go figure it out now if you're on the bus route, because then if you need it, it won't be as overwhelming. Have a plan in place in case it becomes impossible for you to live at home. What's realistic for you based on your finances, based on your social life? Would you want to move into a community? And then of course you can always hire me. I had to throw that in there. So that is pretty much us. I will say, if you want to come in for any reason for a consultation, if you say that you were here at the Ollie presentation, we waive our $400 consultation fee. So there's no charge to come in and talk with the attorney. And I have information over there. If you guys, have any questions, my business card. Does anybody have any questions?
Robin, I do have somebody in the chat. Carol asked that you please repeat monthly cash benefits for eligible veterans.
Oh, so depending on their dates of service during wartime, they can be eligible. A married veteran, $2,642. That's tax-free every month for the rest of their life. And a surviving spouse would be $1,432.
Thank you.
Okay. Yeah. Yes, sir.
Well, just a comment about a couple of things that I've just recently dealt with personally. I recently helped my sister evaluate 3 continuing care facilities, one of which is Presbyterian. Presbyterian they have a waiting list of 100 people. And since they were invented a couple of years ago, they've only had 3 vacancies. So some of these continuing care places can be very difficult to get in. She chose a facility in Macon. All of them are about the same. She put down about $50,000, and then the membership fee, if you want to call it that, was $250,000.
Wow.
And it's a little confusing because all of these places have different plans, how much you get back when you die or move out. What it depends on how much you put down in the beginning.
Right.
And so you have to make one of those kind of decisions. But they're a wonderful concept.
Yeah.
They're also dependent, if there are 2 people, on both people being considered independent.
Right.
My sister's case, my brother-in-law will go into the nursing home facility. She will be independent. His fees won't be locked in. Hers will throughout her movement. The next comment was about the insurance. And I looked for insurance for my wife and I when we were in our early 60s. She was able to get it. I have a tremor, and of course their concern is Parkinson's. I've never been able to get it. So if you hadn't gotten it by now, there's a good chance you're not going to get it.
Right.
It's complicated too, based on the inflation protection and also the wormhole that you described, 90 days, 180 days, that kind of thing. But it went up for my wife about 15% a year for the past 10 years.
Yeah.
The next thing I want to say, question is, does Lyft have that monthly program here in Athens?
I don't know. It says it depends on the area. So I honestly cannot answer that question. I didn't even know about it until I was at a conference and someone from another state mentioned it. So I did look it up, but I don't know if Athens does it. But that might be something worth looking into. And it might not because of our transportation here and because we have so many college kids. But yeah, sorry, I can't answer that. So the continuum of care, I do want to say, just remember they're a business. So the healthier you are, the more inclined they are to have you let you move in, but if you have, health problems, they like you when you're healthy and vibrant, because obviously you're going to cost them less money. I mean, that's just the nature of that. Yeah. Anybody else?
Oh, one comment.
Yes, sir.
When you were talking about the people who want to give their money to their children,
Mhm.
I like the bumper sticker that says, I'm spending my kids' inheritance.
That's right. Yeah, that's right. That's right. And that's one thing, like some of the children, like, so I have clients that their children moved in with them. And now mom, they can no longer care for her and she needs to go in a nursing home, but Medicaid, she's going to go into the nursing home on Medicaid. Medicaid does estate recovery, which basically means after mom dies, they're going to come after the house for whatever they paid for her. And so and the daughter's like, oh, well, I live here. And I'm like, well, I get it, but Medicaid doesn't care. So it's complicated. But anyway, thanks y'all. I appreciate it.
Thank you.
Or die healthy, wake up, just don't wake up one day. That's what everybody hopes.
So we could,
Yeah, thank you.
well, my wife's visiting her grandchildren back, so. We could set up,
Yeah. A couple of things if you want. Okay.
Just don't hit me.
Just
Thank you very much.
that, and just remind me that I saw you here. And we'll get you on the townhouse as well, and our consults are about.
Yeah, we did, that's fine. We've done a lot of this, but we'd like to coordinate it all.
And what we do, and I'll tell you, we invite you to bring your documents, which you always have, just to make sure they're all, sometimes. Yeah, sometimes children get divorced or they get remarried. That's usually where folks are like, oh, I don't like this new husband, those kind of.
Thank you very much.
Welcome. I know, sometimes it's the reverse. They're like, oh, I can put her in the will now. I like who she's with. Yes, sir.
Something out about the VA hospital. I didn't go anywhere near the VA.